actually, understand or empathize with somebody as they're going through a crisis.
So what is it that people actually learn from this course? What is it to actually get from it? So the book that we're passing around, which you guys can see, is the textbook version of what the course actually is. It's very detailed. It's also got all the information that the course would have, but this is something that every single participant, no matter who they are, when they come in, they receive this book and they take it home. And it's free of charge. We give it to them, they take it home, and it's their resource. They use it. So what do they actually take away from this? Using that textbook and using the course itself, we talk about risk factors and warning signs. So a good example that we have today is like schizophrenia. So when we talk about schizophrenia, we discuss how does schizophrenia manifest? What do you see? What are the signs? What are the symptoms? How can you tell if someone is going through an acute psychotic episode? What does it look like? And how do you actually communicate to someone in that moment and get them the help that they need? And this is regardless of location. You could be in a subway car, you could be inside your own vehicle, you could be at home, and someone could be going through a crisis. And the course will teach you how to recognize abnormal from normal, and then how you get them directed to their help. So we cover a lot of issues like depression, anxiety, trauma, psychosis, substance use. And we develop a 5-step action plan. You remember guys, ABC, airway, breathing, circulation? Mental health first aid has its own version of ABCs, and that is allergy. So I'll be covering, so when we take the course, we cover this course. So allergy is a 5-step phenomenon, and the koala bear is the, mascot for allergy. This is a course that was started first in Australia and then adapted internationally. So the mascot is, of course, an Australian koala bear. So first and foremost, A stands for assessing for risk of suicide or harm. Then comes L, listening non-judgmentally. G, giving reassurance and information. E, encouraging appropriate professional help. And then encouraging self-help and other support strategies. Allergy, this is the model that we drill into every single participant that comes into our program. So it doesn't even matter what particular mental health issue you have. So long as you follow the model, you'll be prepared for whatever it is anyone can throw at you.
And just to to cover what Omar just said, when we mention mental health first aid, when we're teaching the class, we make sure to tell people that taking an 8-hour class will not make you a therapist. A lot of people may have the notion that, hey, I'm taking an 8-hour class, I already know a lot more now, and I can go around and give people professional help. It doesn't work that way. We want to make sure that in the event when a person is within the becoming unwell to the unwell phase, this is where mental health first aid is most effective. So we know that in various cases of mental health challenges, that a person may relapse and fall back into it. So your whole job is to support that person until professional help is available at that point in time. And I think it's very important that, so far when Omar was talking about allergy, we probably drilled this things during the class at least 15, 20 times. So by the time people leave the class, it's something that they actually remember and can memorize with ease. And yeah, the koala bear is pretty cute. They actually give us the koala bears when we get the instructor training. So we actually have the koala bears at our houses as well. So. And then with that being said, so the Thrive NYC, with Thrive NYC, we're able to provide trainings for people for free, basically. So basically, when we teach these trainings, we go into the way Muslim Thrive works. So we actually reach out to different community-based organizations. It doesn't matter if the organization is Muslim or not, because we have done this training in synagogues and churches, as I mentioned before. And we reach out and we ask them if they want to do a training. They give us a specific date, and then we connect and we let Thrive NYC or the city agency, we let them know that we're giving this training. And they also put in their system, so they have more people coming in and signing up to take the course. Now, when we do teach these classes, the majority of the classes that we have taught so far has been in Muslim community centers or masajids, but the audiences are not just Muslims. We have a lot of non-Muslims who come in and actually learn from this as well. And I think it's very beneficial because one thing is we're all learning from one another, like how different communities deal with mental health challenges. And it's, I think, been a very eye-opening experience for us because when we first started the organization, we always wonder how can we just outreach not just Muslims, but everybody, because everybody's going through something. So I think this class is a great way of just creating that sort of factor.
So if you guys notice, if you see this section, taking a peek inside it, the mental health first aid curriculum is a secular curriculum. bases itself purely just on a clinical model of what are the signs, what are the symptoms, how do you help? That's it. It mentions, there's a small touch of saying that religion can be a protective factor, but it doesn't go anywhere beyond that. So what Saeed and I have done is we've taken the MHFA curriculum, the standard-based curriculum, and we've sort of twisted it. And what we've done is we have an Islamically infused MHFA curriculum, so that when we present this material to, say, like an audience like this, like a predominantly Muslim audience, what we'll do is we'll use case studies, patient cases, and actual examples from our own community of mental health crises that Muslims themselves have faced, and what the community reactions to those crises are. Now, there's one thing that all of us here know, this is why we even have a Muslim mental health conference to begin with, is that all of us have the understanding that in the broader general Muslim community, the response to mental health crises is extremely poor, if not negative. So what Saeed and I do is the process of destigmatization. Stigma comes from ignorance, ignorance comes from a fear of mental illness. So the only way to remove someone's fear and remove someone's ignorance is to show them a Muslim who is suffering, and to humanize the face of what a mental health condition is. So what Saeed and I have done in some of our classes is we've had Muslims who are lived experiences, those who have had bipolar disorder, come in front of the class and talk about their condition, their symptoms, their treatment, what they're experiencing and how they experience it. We had a Muslim with an alcohol use disorder talking about his alcoholism, and that comes from an addiction perspective. And this is a Muslim discussing these cases. It makes these cases, it makes these illnesses real. It puts a face on it and lets the community know that this is something way more serious. It's not something on a lecture slide that Saeed and I are presenting. This is all of us, and we are all susceptible to it. So using Islamically infused MHFA curriculum, you can reach a culturally and Islamically tailored training for your community. Saeed and I have also taught this course in a church. We've also taught this course at a Jewish medical school, and we've also utilized same scripture-based approaches for these audiences.
And just to follow up on what Omar was saying, is that like we've had instances in which when we go in front of an audience and we're introducing ourselves, especially if it's like a non-Muslim audience, where like we are Muslims and we have experience within like our own families and our own friends who have gone through stuff, and just the whole overall impact of seeing somebody able to come up there and openly and vulnerably talk about what they're going through, I think has a very drastic impact in terms of just being able to instill within people that, wow, these are people that I know on a daily basis that are going through something. And I think that when you see like a lived experience, when somebody is telling you, like, this is what I've been going through, this is why you haven't seen me in 2 years, this is why you haven't seen me like that, or you haven't seen me around like that, it creates a sense of compassion from within the class. So that empathy is developed right then and there, so that when people leave that class, we still get follow-up emails like 6-7 months down the line, like, you guys, helped me realize that the person in my family is going through something. Instead of shunning them, I'm actually being open and responsive to their needs. So, just to cover, since 2016, we've certified 1,601 people in the adult mental health first aid training. And I'll say, alhamdulillah, it's been a blessing to do that because we've met people from a variety of backgrounds. And we also have one of our youth trainers, Bhuiyan. She is right here. She certified 270 people in the youth trainings. Not a youth curriculum. Bhuiyan has done an amazing job because the youth curriculum is very hard to get more people to be actually, to teach this class. Because this class is actually designed to for adults that work with youth. So we've given this course in different Islamic schools, in different community-based organizations, and it's just very difficult to get teachers to come in and do this on the weekend, especially when they're working 5 days a week and coming in on a Saturday, Sunday to do it. So so the responses has been amazing, as we mentioned earlier, done in different schools, houses of worship, community centers. We're basically wherever we can find a space to do it. So this is just a map of our reach. So within the 5 boroughs of New York City, this is the number of people that we've trained in each borough. Staten Island has a low amount of people, I think, because it's very expensive to come in and out of Staten Island. For those who may not be familiar with New York City like that. But the majority of our trainings are done usually within the 5 boroughs. We've done trainings in Long Island as well. And it just goes to show you that when we do provide these trainings, we've had many people tell us, what can I do to bring these trainings into our own communities?
So we've had a few folks that have taken our course and have given us like, what is the immediate impact? How do they actually feel like taking a mental health first aid course? The immediate impact you guys can see on the left-hand side. This is an outlet for people who may be suffering internally from a mental illness, and all of a sudden they have an opportunity now to actually attend a class, and during the class itself they'll raise their hand and tell us something during the class. And it's not really for us, it's for the actual audience to know that, hey, I actually have this. So even I are discussing maybe a case on PTSD or anxiety where someone will stand up and say, I have this. I've actually been suffering from this. At the end of the course, Saeed and I will always distribute resources. So on your tables, you guys will notice there's a little tiny card, a subscribe green card that you have, that you can look at. The card gives you a very, very basic, just most emergency resources that we have available. On our actual website and at the course itself, we have an enormous list of resources that we give at the end of the class. So that even if you yourself or someone that you know at the end of this class may be suffering from something, there is a way for you to get help and get a referral for what you need. And then for the long-term impact, so Saeed and I do get correspondence from people who have taken our course, emailing us and messaging us about they themselves being in a case where their best friend has been suicidal and they've used the Algae method and they've used the communication resources to get that person help or get that person to a psychiatric ER. We've had cases where someone has told us about substance use issues, that they've had addiction issues that they've had, where now they've convinced themselves that I need to get help. We've had mothers in the audience actually say that my child is suffering, and I didn't realize my child was suffering until I took her class and saw the signs and symptoms and connected the two and two together. So what we do here with Subscribe is that mental health first aid is just one part of the community outreach. It's a big part, but it's only one part of the overall thrust of what it is that we're doing. And we have more and more people now reaching out to us for us to come to them and conduct these trainings. One in particular is the American Muslim Health Professionals Organization, who took our model and is now applying it nationally. So there's a national approach now to mental health first aid in those communities that we need.
And just a quick strengths and weaknesses. Obviously we talk about we provide knowledge to people that may not have an idea of how to deal with people with mental health challenges. We look to normalize the conversation because oftentimes when we go into some communities, they respond to, they ask for us to come in after a crisis has occurred. So in New York State, it was, we had in a medical school, 3 medical residents took their own lives while they're in their 4th year of residency. And the community didn't know how to respond, so they called upon us to actually come in and teach the class. And there was a lot of heavy conversation that day. And as difficult as it was for us to have these conversations, it was very easy for us to actually come in and talk to them. We never really left, so. There's some feedback. I'm pretty sure there's some positive feedback. We'll share our slides later on, so so we can go through it. And it's just quick some next steps. So currently, we're always looking, every organization is looking for funding to do their work. One of the ways that in New York City is very plausible for us to do is to work with the New York City Council, where every district within the council has this participatory budget. Where basically they have a allotment of money in which they're able to provide to community projects. So we had a neighborhood reach out to us and they said they wanted us to do be in that community for a whole year. So what we're planning on doing is we give them basically an amount of money that we need to do our projects, and that way we can be in the community and actually find out what their mental health needs are. So the first thing that we're trying to do is with the money that we receive is hire an intern from who lives within the community, because that's a very important thing when it comes to community outreach. That intern is going to identify the needs assessment, to identify what kind of mental health resources are available within that community and where the gaps are, so that we can also take a look at that information and see what we can provide. The next thing we would do is have workshops and focus groups to understand what the people's concerns are with the variety of mental health challenges that the community will be facing, and try to fill in the gaps with that as well. And then we would hold at least 3 or 4 mental health first aid trainings to get the community more aware of how to deal with mental health challenges that they may be facing. And then finally, we also would like to have a community town hall at the end, have a variety of events, just so we can show that community that we are there for them, and we will be there for them for that duration of time. And the voting is actually happening right now. Unfortunately, you all cannot vote because you don't live in Brooklyn in that district. But it's just something worth to know, because it might be something that other cities are doing as well. So you never know.
So that, in a nutshell, is our presentation. If you guys are interested in the mental health first aid model, if you want to come talk to us, subscribe. We have our contact information on those green cards. Please feel free to reach out. And we are looking forward to working with every single one of you guys to hopefully, inshallah, bring this kind of training model to your communities too. Jazakallah khair. Assalamu alaikum. course. Saeed and I ourselves, in order to break the ice, we will talk about our own cases. So Saeed will bring up some of his family members that have suffered through a mental health crisis and what he has done to help them. I usually bring up a lot of Muslim patients of mine that I've encountered and what they're going through. And when the audience hears this and sort of sees that these are two Muslim faces talking about a mental health crisis and what they've done through it, for them it gives the impetus of, okay, we've had cases in our class where someone has raised their hand and said, I know a friend who may be suicidal, and then we'll talk about it. And then we've had cases where we've had someone raise their hand and then they'll say, I'm someone actually on my way to the masjid, I thought about throwing myself in front of a train. Or while praying salah, I had thoughts of, what if I would just die right now, I don't even care anymore. And they opened up about it. And it takes one person in one class, honestly for us, we see it takes one person in one class to open up, and then it's like the floodgates break open. And now every single person now raises their hand, now they're saying, okay, well, I have a mother, I have a brother, it's me actually, the friend I was referring to. That's actually myself a few years ago, I was going through all this stuff. And even if they aren't brave enough to share it in class, every single time we have breaks in our class, it's an 8-hour class, it's a pretty intensive class. We'll have short breaks interspersed in the class, and Saeed and I usually never get a break, because as soon as you get break time, they'll immediately get up from their seat, walk up right to the podium and say, can I speak to you privately? And then they'll pull us to the side and then they'll say, I'm a victim of sexual trauma, or I'm a victim of domestic abuse, or I'm someone who my child is going through this. I don't know what to do. I saw your lecture slides and I put two and two together, but I'm not brave enough to actually talk about this. So either in private or in public, they'll open up about it. What we do in class, this is very, very important, is Saeed and I set up a Google Voice. And the Google Voice is a private number that they can use at any point during the class. They can text in with their phone to that Google Voice number, and only Saeed and I and select members of our team can see those questions. And then we'll give a response to one of our phones, and we'll text them back anonymously with a response to that question. So a lot of the time, Saeed and I will get really, really difficult questions texted in instead of actually said during class. And for us, I feel those are probably a lot more powerful for people, because finally, for the first time in their life, they can just say something to someone and hope to get something from it. So that's how we tend to do it in our classes.
Just to add real quick to what Omar said, another thing that we do is, depending on the community that we're teaching the class at, we try to find out as much information as possible as to why they want the class there, and what caused, what may have happened for them to want the class all of a sudden, just to make sure that, we can go in there and we can be open and honest with the class and say, this is why we're here, and what do you want to talk about. So for example, some classes will start right away with regards to the class in itself. For other classes, we may have an open forum for the first 15-20 minutes. And we know it's going to take some time to get a lot of thoughts and feelings out, but I think by doing that, it sets a tone where people can just be like, okay, now I feel comfortable talking about this, now I feel comfortable learning about these topics. Because we do know that, everyone, I'm pretty sure the word stigma was thrown around here the past few days, a ridiculous amount of times. So when we're able to, dismantle that stigma temporarily in that regard, I think it allows us to come in and, kind of sort of be like a soothing presence where you're like, what, we can trust, the instructors to actually, to find out exactly what we're going to do and how we can trust them. Okay, so Sabine just mentioned, since she is the youth mental health first aid instructor, we do set ground rules as well. It's that we make sure that we have community rules in place. So for example, if one person is speaking up, that all the attention is on that person, so nobody else can cut that person off. And we also tell people, if there are any topics that are very uncomfortable, feel free to let us know, like notify us, we can give us a head nod, or just raising your hand, and you can step out and come back whenever you feel comfortable. Whenever it came to, for example, the topic of suicidality, it can be very difficult. We've often had family members, people within the class who have had family members, that have attempted it. And what we tell them is that if it becomes very uncomfortable, please feel free to walk out, come back in. And when you do come back in, give us a signal that you're ready, or you're good to go, and then continue the class.
Back over here. So, question is do you train in other states or countries?
So the answer is yes. The technical answer is Saeed presented Thrive NYC. Thrive NYC is a New York program that completely facilitates this process. So the process to become a trainer, to actually conduct a course yourself, costs like $2,000. And Thrive NYC, the city government, waives it. They actually give it for free. The training itself, you actually have to pay for. So participants come in, they pay for the training. The textbooks that you see in front of you, they pay for those textbooks. And the course itself they pay for. Thrive NYC waives all of that. So Saeed and I are able, through the city government, we offer it completely free of charge for everybody. However, once you leave New York and you step outside, now you're on your own. Now we have to charge for the course. Now people need to have ticketed entry. So American Muslim Health Professionals, the organization that took our model and is going national with it, unfortunately for them, they have to charge for people to come in. So finances does become a big issue once you leave New York. We have training. Outside there is a particular model that I'm hoping, inshallah, to later this year bring to Christchurch, New Zealand, and offer this course to them and their Muslim community in the hopes that this can be trauma training for them. And I don't intend on charging for it. However, when you go international, usually what you do is you order your books and your materials online from National Behavioral Health Council, and they send you all your books and materials, and then you distribute it to your class. That tends to be the model for what you do when you're outside of Thrive NYC's jurisdiction. Whoever asked that question, I know it was a technical answer, but I hope that helped.
Another thing we can do is if you do reach out to us, if there are any organizations within your own state that are doing this kind of work in connection with them. And also, for example, if we're going to be working with another masjid or another organization, perhaps you can talk to them and ask them if they would cover the cost for the for the people who are interested in taking the course.
Yeah, and then Saeed and I would be happy to come over and have the course for you guys.
I always want to travel. I like traveling.
Adam Center.
When's your next course?
We would love to do it at Adam Center. That was a beautiful presentation.
You're welcome. You're coming.
Yes, it was done. That was under American Muslim Health Professionals.
Yeah.
It was very well marketed. MHFA.
Thank you so much. So we do have to move on, but I just want to say thank you so much for the questions, and can we get a round of applause for